a particular community has a specific attitude towards a particular health kind of intervention, but not only a particular health intervention, but we also look at majorly uh, we can look at how a community's attitudes towards a specific kind of intervention is, including interventions against interventions against like vaccination, interventions that aim at trying to reduce the outbreak of diseases such as malaria nets. So you realize from what we've discussed, you can actually be able to determine some of the particular reasons as to why those particular services, especially the
Celular.
discuss what we're going to do today, and finally how we're going to be able to conclude this particular module. And let me just start to share my link so that we can actually kick off. Samuel, I think that is okay. I can proceed.
Yes, you can take off.
So let me just share my screen here. So there, that is what I want us to conclude with. Having understood all those particular aspects of sexual reproductive health communication and education and promotion, uh, we want to understand designing an effective health communication campaign. And I was saying that strategic design is the hallmark of successful health programs, and meaning that for us to be able to have a successful health program to achieve the particular objectives that we have set, the strategic way of designing, or what we call a planned way, uh, is the way to go if we were to achieve a successful health program. And over the last 20 years, health communicators have come to realize that collaboratively designed, implemented, and evaluated health communication strategies will help achieve the goals of improving health in a significant and lasting way by empowering people to change their behavior and by facilitating social change. So, meaning that you shouldn't be determining or you shouldn't be designing your communication strategies as an individual alone. And therefore, they have realized that there is a very great need for us to do collaborative designing, but also to implement such activities or to evaluate them together with the community. So, sexual health. So, we now want to do a case study. The last time I told you that having discussed sexual health and reproductive health promotion and communication, it is important that we do a case study. And we want to just do a simple case study on a particular aspect that is a socially constructed phenomenon influenced by social norms, culture, and personal experience. It is a complex and multidimensional define, feel, and perceive sexual health in their lives. There seems to be an upsurge in the use of the sexual health concept world over in the recent past. Sexual health everywhere is understood in a framework of prevention, a public health oriented domain of discourse concerned with prevention of disease. The preventive domain is the most dominant domain of discourse concerning sexual health. So we're trying to define for you here sexual health in terms of its social aspects, and like we said before, that the attitudes and behaviors of individuals either towards a disease or towards a sexual health aspect are influenced by these social norms, their cultures, but also their personal influence that is well determined in the health belief module, that is well determined in the socio-ecological module, how issues around evolve and affect an individual's health behavior. So that is simply what this statement is meaning. So the way those particular factors influence an individual are the same way the person will feel about their sexual health. So what happens is that the sexual health aspect has brought in an idea or the framework of what they call prevention. And this prevention is a public health domain or aspect that is widely used in the prevention of many diseases. That the individual needs to be well equipped with information or with strategy that can help them develop strategies that make sure that they do not get a certain type of illness or their sexual health is well maintained. So, prevention of illness or prevention of diseases has become a widespread issue, so that the morbidity levels in communities are reduced. So, according to the WHO, sexual health is a state of physical, emotional, mental, and social well-being related to sexuality. So, it is not merely the absence of disease, dysfunction, or infirmity. We know aspects of dysfunction such as sexual infertility. So whereas the WHO defines health in a similar way, but you realize that it looks at the completeness. But at this aspect, we're looking at the sexual looking at a case study that is about sexuality in there. So, if so, how do we design an effective sexual reproductive health communication campaign? One, in this case study, is the analysis of the situation. Purpose, what is the health situation? We're looking at India. The health situation is HIV/AIDS. What are the key health issues? Behavior or change that needs to occur to improve the health situation. That individuals change their behavior through using condoms, through having abstinence, through being able to do testing. So the health issue is that individuals do not use protection, or they do not use condoms, or they do not do HIV testing, so they don't have the testing their test results, or they do not know their state. So it is now upon you, having identified this key health issue, that you're able to try and engineer something so that there is an improvement in the health situation. So you have to analyze the contexts. So these are all in situational analysis. What are the strengths, what are the weaknesses, opportunities, and threats that affect the health situation. Probably you may think there are social laws, there could be community traditional laws, there could be religious laws, there could be the level of education, there could be cultural background, or there could be individual factors like poverty, and so forth and so forth. There are a lot of issues, could be age and so forth. So you're also able to identify gaps in information available to the program planners and to the audience that limit programs' ability. Then you do formative research, new information that will address the gaps. And then you do a communication strategy. You're able to identify your audience, the objectives, positioning, and long-term identity, strategic carefully discussed earlier on. And then lastly, here you have to do a management consideration where you're able to do partner roles, responsibilities, timeline for strategy implementation, the budget, and then the monitoring and evaluation. So this is complete uh, uh, system or strategy for doing an effective health communication. And I thought I should now bring that aspect in the last minute. So the case study we want to look at here entails what we call the prominent health communication approaches. And health communication has changed drastically over the last half century, passing through at least four different periods. We have what we call the CAM, medical model. The notion during this era was that if people knew where services were located, this was the first era in communication approaches. So what you needed to do only was that you needed just to construct, and then people will come. Then it further advanced to what we call the field era, where a greater emphasis was on outreach workers, community-based distribution, and a variety of IEC or information, education, and communication products like posters, leaflets, radio broadcasts, and mobile units. Then the third era is what we call the social marketing era, premised on the facts that consumers will buy the products they want at subsidized prices. Highly promoted brands stimulated the demand side, while convenient access through local shops and pharmacies expanded the supply side. So the fourth era is what we call the era of strategic behavior change communication, found on behavioral science models for individual communities and organizations. And this is actually where we are now. Away from all the other eras, you can be able to realize that the era of strategic behavior change is where now sexual reproductive health communication falls in. Influence social norms and policy environments to facilitate and empower the imperative, the imperative and dynamic change. So if you're able to realize that actually if you did a behavior change communication approach, you'll be able to have an influence on the social norms. Why an influence on the social norms? Because uh, they are actually the main causes of why individuals have problems with access to certain health services. So as a result, the field of health communication has evolved and expanded greatly. So, from being initially a matter of high volume production of simple print material posters, where they only used to print, initially in health communication, they virtually just needed to print a few material facility component of health programs. So no longer simply repeating untested slogans. So those days it was just an issue of slogans. They just put their slogans. A small family is a happy family. if they wanted to improve, if they wanted to preach an information on family planning uptake, or providing pictorial instructions on why and how to use specific contraceptive methods. So they would just have these IEC materials and place them in health facilities, in the public places. They would have photos and so forth. Communication is now a vital and indispensable guide for many interventions. So it represents not only the most conspicuous part of most preventive health programs, but also the strategic themes to enhance the importance of health programs for policymakers and the public alike. So today, strategic communication preventive health services, but also to motivate the suppliers of health service providers at all levels. Whereas you're giving information to a client uh, through communication, health communication is actually trying to tell you that you have a role to play, and you have a role to motivate people who supply uh, health commodities. So at all levels, because of the aspect of communication, you're able to impart information into individuals, and through that kind of projection method, where one individual is able to go to another village and impart this message, and the peer continuously gets such information, you realize that it is a motivating factor for several health service providers. So many to emphasize communication. So growing evidence that well-designed communication interventions can have an impact on health behavior and practices, not just knowledge and attitudes. So if you're to realize that research showed or research has shown that well-designed communication interventions have actually been able to help in positive attitude change, but also it has been able to show good practice, good health practice among communities where such communication has taken place. So a substantial expansion in mass media has actually given room that communication approach is very important, and has contributed to it being more of an emphasis. Why? Because then new information technologies such as X, which was formerly Twitter, or you're using especially televisions, then you can be able to communicate. That is why you'll be able to see in the radio stations that there are now channels or there are now sessions where there is a health talk, and therefore people are being communicated to some of the health issues, and which in the long run or in the shortest run possible can change their attitudes but also their practice to be positive. Also, the decentralization of health services, giving more power to the local governments, was able to increase the need for communication for health have been to the lowest clients there, who can then utilize some of these health services. The increased attention to the role of women and other gender concerns, another reason why communication in the health system, because then if you realize other gender norms that included exclusion of women, uh, the failure to make decisions because they cannot make a decision on uptake of contraceptives and so forth needed that women are given clear information through communication. For example, you're able to offer the woman all the information, and then they are able to make a choice on those particular kind of method they would want to use. Healthcare services, including counseling and client provider communication, are some of the key reasons as to why communication has become an eminent part of health system delivery. So, meaning you have to have a better quality of how you interact with your client, how you treat your client as a service provider yourself. The spread of HIV and the growing recognition that child health and control of many emerging diseases may depend as much on individual and community behavior as on the medical technology. There's an increase in the HIV and AIDS, but also some of the emerging diseases, such as cardiovascular diseases. While before, vascular diseases such as diabetes, such as high blood pressure, we were not seeing Alzheimer's, we were not seeing. There are a lot of diseases that were what we call a rich man's disease, but in Africa we have seen them become very common, and this is due partly because of the balancing or the diet or the only imperative that this information is then passed on to them, that they can have a change in health behavior. Then the chances that we can have better health outcomes are very high. So, secondly, let's take account of complex interactions, including involving individual behavior, community norms, and social structure. So, including all the continuous research that has shown behavior change uh, being a subject of interaction of different aspects means that we need an approach of offering people information, and this information can only be offered through communication. So if you're able to do such communication, then there is need or there is a will that you will be able to break the social interaction. So, meaning if the social interaction in communities was a negative interaction, for example, the community has a negative belief about maternal delivery, the individual then, because of the interaction, possibly develops a negative energy about having maternal delivery. I mean, maternal deliveries at what? At the health facility. So, if you can, through communication, you will be able to influence some of these community norms, but also social changes, and then subsequently, you are also able to influence someone's individual thought or behavior. And you will realize that through your communication, people are able to attend to you. So, communication continues to be more HIV, but also in any other disease. So, in the absence of a vaccine or a cure, prevention is the most effective strategy for the control of HIV and AIDS. So, around the world, the majority of the population is still uninfected. It is therefore it now therefore becomes very important to continue intensive communication efforts that will not only raise awareness levels but also bring about behavior change. So if we can continuously mobilize and tell people information about HIV, how it is spread, and so forth, and so on, then we can have behavior change. And in this regard, we're talking about behavior change approaches like using of condoms. We're talking about abstinence. We're talking about HIV testing, but also we are talking about limiting your sexual partners and all this. And So if we looked at the case study on HIV communication for India, you realize that there are basically two kinds of communication approaches that were adopted by the National AIDS Control Division in India. So you realize that India uh, had a high cases of HIV infections, and therefore you can realize that they adopted a two approach kind of method to handle their situation. So this approach was to communicate sexual health to the community or to the masses. Information education and communication approach, which is basically a top-down approach. And other approach, bottom-top approach, is what we call the behavior change communication. So India used two kinds of approach: the IEC versus the BCC. Information education and communication is a process that informs, motivates, and helps people to adopt and maintain healthy practices and life skills. It aims at empowering individuals and enabling them to make correct decisions about safe behavior practices. Information, education, and communication also attempts to create an environment that is conducive and supports access to treatment services for those already infected. So, this is just a brief of IEC and BCC. So, in the next slide, I just made a table summary of IEC and BCC as approaches that India used in this case study. And uh, you as a health communicator, you should be able to now understand uh, which method can actually work for you in your community, and then you will be able to apply accordingly. So the differences are just here. Method, message is sent to a health facility and offer, I mean to a community, and offer them information. And this information can be through placards and so forth. You just go and give them. You just go and give them placards and so forth. So you don't expect an immediate result from the information you have distributed. But if you're doing a behavior change communication, then change is expected. But also the approach, like I said, it is top bottom. I mean, it is top down. So meaning people from of health, they are the ones who design a certain type of message and give to the community. However, for a behavior change communication, you're able to go to the community and get their problem. You remember what we said about needs assessment, that you will be able to get information from the community, and then you'll be able to identify what their needs are, and you can consequently make a decision. How is the information conveyed? This information is conveyed, if you're using IEC, it is conveyed through newspapers, through the radio, through placards, through sometimes people use audio, sometimes they use these flip charts, or they just put their brochures and so forth. However, with behavior change communication, you're able to offer the information directly to the targeted group. The process for IEC is one way. There is no feedback from the recipients. You give them the placards, you give them information through the newspaper, and it is there. There is no room for feedback. However, for behavior change communication, you're offering a two-way kind of interaction where it is a dialogue. You give information to your target group, and they can be able to give you feedback. Relationship. No relationships as messages are conveyed through indirect sources. So most times you're using newspapers, you're going to the radio, so there is no relationship that is built because you're doing an indirect kind of passing the information. However, in behavior change communication, you're doing an interpersonal kind of relationship where you're dealing directly with the individuals, and then you can be able to get their side of the story, and you can also be able to reflect. Similarly, if you're doing an IEC, you're targeting a group or a larger group, meaning many people who are listening to a radio, many people who can get those charts, or many people who can access your IEC materials, or many people who can be able to look at the television set. However, if you're doing a BCC, you're mixed in a very small group, your target group, so that there is an interactive session and you're able to hear each point of view and you can act on it accordingly. However, the focus of IEC is on a specific message. So most times you may be looking at a particular information, maybe HIV/AIDS, maybe family planning, maybe you're just particularly looking at antenatal care. However, in BCC, you can be able to look at a various range of issues. You focus on a very many variables. You can be able to look at maternal antenatal care attendance. You can be able to look at vaccination and so forth and so forth. So that, and practically that concludes this particular module that we have been discussing. However, as a post-module evaluation, you should be able to now answer such a question. You should be able to answer this question as your evaluation, which I have stated here. And it is saying that according to a health facility in community A, which is in village A, in community has in the recent past 3 months reported an increase of HIV/AIDS infections among young people aged 15 to 49 years. At the at the HIV testing services offered at the health facility, there are also a trend of an increase in the malaria and flu cases in the same region. The mortality and morbidity rates due to malaria and HIV/AIDS has risen to 250 per 1,000 persons respectively. As a sexual health and reproductive health communication specialist and educator, explain how you would identify, design, and implement a health education and communication project to help this community. So this should be able to give you a picture on how the entire module has been flown and how you can be able to put whatever things that you've learned into practice. So that is the question that I leave you with for today. And that ends the lecture for today and the module for today. So those who subscribe for fertility, we shall soon be continuously working on fertility. I think I will communicate when we can have that particular lecture. So back to you, Samuel. I think unless we have any question from Stephen, that would be the end for today. Stephen, do you have any question?
Hello. Can you
Yes,
hear me?
Stephen.
Are you hearing me? Yeah, I'm saying
I
I
can
really
hear
don't
you.
have
Yes, I can hear
questions.
you.
I am in a bit, yeah, my network is not okay. I'm saying Thank you so much for the wonderful presentations. These are very good model. We'll be in position to actually use the slides and go through them to ensure we really focus at concentrating and mastering all the areas that you lecture with them. Thank you so much.
All right, thank you for that feedback. So, Samuel, that is the end of the lecture. Eh? Have a good evening.